This video has been created to provide you with important information about your oral cancer drug and to help you to better understand how to take your medications at home. Please watch this entire video before you meet with the oncology education nurse so that you will be prepared for your appointment. If your medications arrive before your appointment, please bring them with you so that the nurse can review the instructions with you. You may need to have lab work or other tests done prior to starting your drug. The education nurse will give you specific information about the drug prescribed for you, including the side effects and monitoring instructions. Do not start taking your medication until you have been instructed to do so by the nurse, nurse practitioner, or your physician. Oral cancer drugs are taken by mouth as a tablet, liquid, or capsule. Traditionally, most cancer treatment was given by an IV. Today, there are several different types of cancer medications available, many that can be taken by mouth. One type of drug is cytotoxic chemotherapy. These types of drugs are designed to destroy rapidly dividing cancer cells and may have many side effects. Targeted therapy is another type of treatment that is used to block the growth and spread of a particular cancer cell. Hormonal therapies can also be used as they reduce or block certain hormones that support the growth of cancer cells. Each of these drug types can have different side effects. Your nurse will provide you with specific information about the possible side effects of your oral cancer drug. Each of the oral cancer drugs can have side effects. These may include gastrointestinal problems, fatigue, hair loss, low red blood cell count, low white blood cell count, and low platelets, skin problems, or hot flashes. It can be very overwhelming to consider all the various side effects of these medications. You will be provided more information about your particular medication at your education appointment. It is important for you to know the name of your cancer medication, the exact dose, and when you need to take your medications. It is a good idea to carry this information with you in case of an emergency. The dosing of your drug is very specific in order for the treatment to be effective. It is important for you to take the correct dose at the correct time. Taking more or less than the ordered dose can be harmful. If you are not clear on how to take your medication, please don't hesitate to call your nurse for assistance. You will need to know when to take your drug, including the days of the week and the time of the day, whether you should take your medication with or without food, or before or after meals. This will affect the absorption of the medication. The nurse will review with you whether your cancer drug may interact with any of your other medications. Please bring a list of all your daily medications, vitamins, or supplements with you to your appointment. Try not to miss or skip any doses. These medications should be taken at the same time during the day in order to maintain a constant level in your body. If you should miss a dose, take it as soon as possible, unless it is closer to the time of your next dose. If it is, take it at the next scheduled time. Never double the dose, as that can be harmful. Do not crush or chew oral cancer medication. If you have difficulty swallowing pills, please notify your nurse or oncologist. Safe handling of your cancer medication. Oral cancer medications can be as powerful and potentially dangerous as IV chemotherapy. It is important that you follow these safety precautions when storing and handling your oral cancer medications at home. Cancer drugs should be stored in the original packaging until used, or placed into daily pill boxes without mixing with your other medications. They should be stored in a cool, dry place away from food, drinks, children, and pets. Note that some medications may need to be stored in the refrigerator, so read the package for storage instructions. Empty pill containers should not be reused or recycled. The pill bottles may be disposed of in the regular trash. Whenever possible, you should handle your cancer drugs yourself. Always wash your hands with soap and water before and after handling pills. If someone else is handling your cancer medications, they should wear gloves and wash their hands with soap and water after removing the gloves. Pregnant women should avoid handling oral cancer drugs. Always keep all cancer medications away from children and pets to avoid any accidental exposure. Do not throw any leftover or unused cancer drugs down the toilet or in the trash. Check with your local health department for instructions on where to dispose of unused medications safely. Cancer medications can remain in your body for up to 48 hours after you take them and can be present in small amounts in bodily fluids. Any clothing or bedding soiled with urine, stool, vomit, or blood should be laundered separately. Caregivers should wear gloves if they may have contact with the bodily fluids or soiled items. It is advised that you close the toilet lid and double flush after use while taking oral cancer drugs. Do this for 48 hours after you have taken your last dose. Prevent small children and pets from playing around any toilet or drinking toilet water. The cancer medications you will be taking are powerful medications and can be dangerous if not monitored closely. It is critical that you have your blood drawn when you are instructed to do so, even when you feel okay. You will be scheduled to come into the clinic for nursing visits. You will alternate visits between the nurse and the doctor or nurse practitioner. It is important for us to follow you and to make sure you are taking your medications safely at home. Please note that even though this chemotherapy is taken by mouth, it can be just as powerful and potentially dangerous as IV chemotherapy. Your oral cancer drugs will come to you from a specialty pharmacy. The pharmacy will contact you regarding your prescription and will deliver it directly to your home. Please notify your nurse if you have any concerns or you do not receive your drugs when expected. If you cannot afford your oral cancer medication or have difficulty obtaining it, please let us know, as there may be resources available to you. Here are some symptoms that you should report to your nurse or oncologist as soon as possible. Any fever 100.4 or greater, nausea or vomiting that's not relieved by anti-nausea medications at home, mouth sores that interfere with eating or drinking, or a heavily coated tongue, diarrhea or constipation that lasts more than 24 hours. Please refer to the printed information provided to you during your education session for instructions on how to manage the possible side effects for your cancer drug. If you have any side effects that you cannot manage at home that occur between your clinic visits, please call your nurse practitioner, oncologist, or nurse. Do not hesitate to call us if you have any questions or concerns regarding your cancer drug. Thank you for taking the time to watch this video. We encourage you to share this video with your family or caregivers. Please know that we are here to assist and support you throughout your cancer treatment. At the Cancer Center, we realize that this is a very difficult and challenging time. We are here to provide support, education, and hope to you, our patient. We want you to know you are not alone.